नमस्कार दोस्तों, मैं अमिताभ and you are watching Ed Talks with Amitabh. And as you are aware that in Ed Talks with Amitabh, we always go with our vision and objective of this platform where we try to bring in a social influencer or an educational influencer. We try to bring in experience from their life, or we take up a theme where we want to generate the awareness, either from the experience or from the expert, or both and the blend of both. And in the journey, we have brought in people and professionals and influencers from all across the country, and as well as beyond India, from different corners, from different walks of life. Today also we are, we have been talking about various aspects, and this is a basically a we all, when we meet in our social gatherings, and if we find there's one person who is unwell, or there is suffering from any ailment, we have a general tendency that other than there is one person who's quiet and everyone else is talking about, has one advice or the other ready for each other. Somebody gives a Ayurvedic recipe and another one gives an homeopathic recipe. We are ready with an advice that from the allopathic systems as well. And there's one person who quietly observes everyone in that social conversation, you're not making any comment on that. And hence, out of all these people, the person who's quiet, generally you'll find, is the professional, who's the doctor, who's the qualified one, because he will speak when it matters the most. But we all have become experts. And today, in this episode of Tech Talks with Amitabh, we have invited Dr. Vikash Prakash, a very eminent doctor at a very young age, has acquired a very distinct achievements and the popularity with people for his practical approach and the simplicity towards the ailment, and making the patients and the clients who reach out to them very much at ease and not psyching them with the problems. And when I reached out to him and I said, Dr. Saab, can we take up issues which are from our day-to-day life and the situations? We all are, there are so many things. Because of our ignorance, it starts getting aggravated. And by the time we reach to a professional, things which could have been prevented with an awareness and adequate and the right awareness, it gets aggravated, and that's when we reach out to the professional. So this episode of Ed Talks with Amitabh primarily aims at developing an awareness, a medical awareness about things that we generally encounter, things that we generally talk about, and we think we are quite aware of them. So let us validate our awareness straight from the expert, or get an insight and get clarity, so that we do not commit a mistake out of ignorance about things which we have, information that we have acquired through Google. Half information can be very, very dangerous. And to educate us and give awareness to us on the theme and the topic, with us, we have Dr. Vikash Prakash. Dr. Vikash Prakash has a very distinct achievement and the expertise. He's, we talk about specialist. He's got his super specialization. He's done his, all his MBBS, his MD, all from Delhi, from Safdarjung Hospital. He's done it from the Ram Manohar Lohia Hospital in RML Hospital in Delhi, his MD. And then he's gone on to join to do his doctorate in medicine. It's not just a doctor just because he's a MBBS or MD. He's also done his doctorate in medicine. He's done his DM in hepatology from one of the largest institute in India and Asia, that is ILBS, that is Institute of Liver and Binary Sciences in Delhi. And this is not just a medical college or a hospital. This is, friends, a university, one of the rare universities. It is a liver university itself, and that is where Dr. Prakash has done his specialization. So no one better, in my understanding and my association, who can get us an insight. We have tried to get you doctors earlier also in our episodes. We had a doctor who have talked about corona in kids. We had a Dr. Dolly, who has talked about the dermatology and hair and skin related issues. Today we are going to develop an insight into medical basics and lifestyle issues that we are facing. So without any further delay, let me invite Dr. Vikash Prakash, who is connected to us right now, waiting in a school times studio, virtual studio, connecting straight with us from Kolkata. Welcome to Ed Talks with Amitabh, Dr. Prakash.
Good evening, Dr. Amitabh. So it's my pleasure, and I'm very fortunate that Dr. Amitabh gave me this platform to bring forward my views and to help everyone regarding the diet what they should take, ways to boost their immunity. And everybody does a health checkup annually. So how do you interpret your reports? You get a LFT done, you get a hemoglobin, you got TLC, DLC, urine, ultrasound, you find an ultrasound stone, gallbladder stones, kidney stones. So how do we interpret what should be the diet? So today we'll deal with the preventive aspect. If I treat the body, Dr. Amitabh treats the mind, so it's just complementary. So both are very important because mind controls the body. If you're not this you are disturbed in the mind, your body can never function correctly. So a very astute clinician, Dr. Amitabh, I am a big fan of him, and thanks for the opportunity, Dr. Mita.
Thank you so much, Dr. Prakash, and I'm really flattered. I think we have a mutual appreciation, and the feelings are mutual for each other. And looking forward to it, as you quite beautifully pointed out, it's mind and the body blending together. And right now on the screen, audience has a psychologist and a medical practitioner together. But then we are going to develop an insight that everyone is talking about on the basic areas as you talked about. So that's going with the issues and the when we talk about medical health and what are the few basic things. I mean, going as a doctor, you would ask people to be careful about and caution when we talk about the medical terminologies and medical disease. We think we are expert about almost everything. So what are some of the key issues and the core issues you would like to caution the audience straight away?
See, Dr. Amitabh, let's ask let's see what the audience what get to see the most. So what they get to see the most is, like, even for me or even for you, what you have undergone is your food right from the time we were born. So what food should we take? Should we take a gluten-free diet? Should we take a vegetarian diet, non-vegetarian diet? What do they do to our body? How, and this corona times, how do we build our immunity, and what are the blood tests we are doing? What do they say? Everybody does a blood test. You go to a doctor, physician, whoever, if you have heart disease or if you have diabetes. So what does your blood report say? What to interpret? Don't come to us for everything. Let the doctor's time remain for some critical issues. There are a lot of issues for which you don't have to go to the doctor. You can interpret yourself, and you can take help of a physician. You don't need a super specialist for everything. So that's what we have come here to help you with. A liver ultrasound, a fatty liver, gallstones, symptoms of liver damage, gut microbiome. So maybe we can discuss on these things, Dr. Amitabh.
This brings me to a very direct question to you, Dr. Prakash, and that is, even in last 1 week's time, on the WhatsApp, there are multiple videos that I'm getting. Now, one video says that this gluten-free diet is a facade; it is more a marketing gimmick. And with very convincing data and the statistics, and the person who speaks on the video is also a very, very good communicator. On the other side, we get another video which says that while you are choosing your diet, it should be gluten-free. Now, as a common person, as a lay person, we get confused with this multitude of the information broadcast through the informal sources, and that becomes very, very confusing. So what is your take? When we talk about gluten-free and all, is it really necessary that we need to be sensitive? And if we are looking at what kind of dietary precautions we should take?
Dr. Amitabh, see, gluten, everybody has to get gluten-free. It's an unreality. It's a far-fetched thing. Absolutely not necessary, because, since our ancient civilization, we have been consuming cereals. So if you speak medically also it's impossible. Did anybody in the past, they didn't have any disease, they used to have gluten? Even now, if you see all the athletes, if you see all the WWF champions, are they
Right.
on gluten to be healthy? Are all the masterminds in medical science or in engineering or any other field, are they on gluten free diet? So it's impossible and it's not required. So gluten, it's a component of wheat. Wheat has multiple components in the cereals, and gluten is just one of them. So
Right.
you have to avoid gluten if you are allergic to it. There is a particular disease called celiac disease in which you have a gluten sensitivity. If that patient starts with gluten, they don't absorb gluten. So their body reacts, their intestine reacts, they start having vomiting, they start having loose motion, and they start losing weight. So if your child in adolescent doesn't gain weight, if you
Right.
see at years of age you start losing weight, you have abdominal symptoms, you have loose motions, go to
Right.
your doctor, test yourself for celiac disease. There is
Right.
just few other class of patients who are non-celiac but they have gluten sensitivity. For these
Okay.
patients, if you start them on gluten, they will have similar symptoms. So these are the only two classes of patients who have to be on gluten-free diet.
All right.
As a medical science, we are yeah, in allopathic everything is based on evidence. So if
Right.
we take patients of fever with malaria, we'll give 5 patients malaria drugs, will 5 patients we don't give malaria drugs, then we see
Okay.
who is benefiting from what, and that is how we statistically analyze and see the benefits. So Dr. Sanya and all evaluated the 10 or 15 patients with gluten-free diet, and they studied in the gut microbiome level what is happening. Is it causing any benefit to the patient? So what they
Okay.
saw, the beneficial bacteria, that is, bifidobacteria and lactobacillus, they all decreased. These patients
Right.
didn't benefit of gluten-free diet. So go for
Okay.
a elimination diet. So good gluten-free is you're eliminating something from your diet. So if you're
Right.
going diet, you have to have an allergy to that, otherwise it is useless for you. If you have problem, you have to, if I'm allergic to pollen, I have to avoid pollen. If I'm allergic to cigarette, I have to avoid cigarette. If
Right.
I'm allergic to eggs, I have to avoid eggs. So it is as simple as that. If you're allergic to gluten, go for a gluten-free diet, otherwise not. And if you have gluten allergy, do you know the amount of gluten which is enough to cause loose motion? If you're using a lipstick, that also has to be
Right.
gluten-free, as minute as that. So you can't say that
Okay.
I'm not eating meat, I'm not eating cereals, I'm on a gluten-free diet. So it's not that way. You have to eliminate everything. So you buy your food from a gluten-free shop. So it
Right.
cannot be 50 that I around 70% of my food is gluten free, and then I'm using chocolates also. That's not from a gluten free shop. So that's not what is called gluten free. So if you have celiac disease, if you have gluten sensitivity, you buy foods from a gluten free shop. You are completely gluten free. You start gaining weight. You have no abdominal symptoms. So no gluten free diet for all. It's not practical also. In India, financial issues are also a problem. Procuring gluten free products also is a problem. So don't, people should not be misguided that gluten free diet is better than a normal diet. Since ancient times it has not been good, and in future also it's not going to be good.
All right. That's a very very insightful and friends. What I could sense from what Dr. Prakash mentioned just now, we at times when we are in a social gathering, there is a friend of ours who has who had this gluten sensitivity, has gone for a gluten free diet and has benefited. Now comes up and talks about it. See, I have done. I am taking gluten free diet and I have got so many benefits and I am better off, and then rest of us feel that that is a general method and a general prescription. It is specific to a condition. It cannot be taken as a generic mandate that gluten free is always going to be good. If we do it generically, it is going to be a major issue and a major
Correct.
problem for us, and that
Very
is
correct. But
very very critical.
what happens in the body, when you have abdominal symptoms due to gluten free, and you have losing weight, abdominal symptoms, we do an endoscopy. We do
Right.
go to duodenum, small intestine start. We take a biopsy from that. In the
Right.
biopsy slide, what we see is the flattening of the villi, which absorbs the nutrients from the gut. So if there
Right.
is loss of the villi, we call it as a sensitivity, and you see out and out that there is a problem. Then you stop the gluten. Then you do an endoscopy again after 6 months. If the villi has recovered, you have a gluten sensitivity, and lifelong you will be on gluten-free diet. That's
Okay.
impractical. for most of us, and you can't have a generalization like you pointed out. That's very correct.
All right. This, there's a season that I feel that happens in our society. There's certain terms start becoming very popular and more talked about, and this gut science is something which is lately being more talked about in the social discussions as well. And this, when we decided and when you are going to feature in our show, we have thrown spread the word, and we got some queries in the emails as well. And one of the query which I could recall was that does gut microbiome, biome affect any disease? What are the kind of tips you would give in the context of gut microbiome?
So, Dr. Amitabh, see, presently everything is revolving around diet and microbiome. Microbiome is basically the bacteria and the bacteria and the living organisms in your gut, which
Right,
positively modulate your gut. So they all
right,
depend on the kind of food you are taking. So
right.
if you have a gut, there is microbiome in the gut. That is the bacteria in the gut. There are healthy bacteria. There are unhealthy bacteria. So
Right.
gut microbiome normally affects chronic diseases. Chronic diseases, what are chronic diseases? Are the long-term diseases like diabetes, like IBD, Crohn's disease or ulcerative colitis, atherosclerosis, fat deposition in your heart and brain, which
Right.
causes stroke and heart attack kind of thing,
Right.
cardiovascular diseases. So these are the long-term diseases which are affected by gut microbiome. So their good bacteria are the lactobacillus, bifidobacteria. Bad bacteria are the bacteroids. So gut
Okay.
bacteria, so they're not affected. If somebody is transferring from a vegetable diet and straight away the next day the patient goes to a vegetarian diet, within 24 hours this the gut bacteria changes.
Okay.
50% of the stool, 50% of the stool which you pass is bacteria. Just see the amount of bacteria which is living in your gut. So, but
Right.
within 24 hours, what they modulate is modulation of the intestinal mucosa from where food is entering our body. So, some bacteria, bad bacteria, they increase the translocation of maybe sugars. So, in diabetes, they will increase the translocation of sugars. So, this is how they can cause diabetes, increase the sugar levels. If there are bad bacteria in the gut, they increase sometimes something called TPMO. So
Right.
these methylene oxidase compound, they increase the atherosclerosis and the heart diseases. Also,
Okay.
the permeability of the gut is increased, the barrier protection of the gut is increased, then they cause IBD, blood in stools, diarrhea, and this kind of disease which is called IBD. So gut
Okay.
microbiome is very important, and it all depends on the food you take. So
Okay.
somebody may have a question whether you should go for a vegetarian diet or non-vegetarian diet. So these kind of things do affect the microbiome of the gut, and all the microbiome changes has a uh, implication on the microbiome which
Does,
is in the.
does vegetarian and non, being a vegetarian or non-vegetarian really affect this?
Yes, correct, Dr. Mohan. Very right question. The vegetarian diet increases the formation of good bacteria. Vegetables have non-digestible, components, complex carbohydrates on which the bacteria feed. And, the multiplication of bifidobacteria, lactobacillus, they lead to formation of short-chain fatty acids. And these are very
Okay.
beneficial to the body. So once there
Okay.
is increased short-chain fatty acids, they decrease the inflammation, and everything is related to inflammation. Inflammation is what? Like we have an injury in the hand, we have a boil, it becomes red, so that is inflammation. So this is what
Okay.
you can see in your hand. But what are you doing to your intestine? You can't see. What you can see from above is only some abdominal discomfort, bloating, and these kind of feelings. So vegetarian diet increases the good bacteria, short chain fatty acids, and decreasing the inflammation. On the
Okay.
opposite hand, if you take animal protein,
Right.
non-vegetarian diet, so that also amount depends. Okay, if you took a lot of non-vegetarian diet like the Western diet, so if they take the lot of non-vegetarian diet, it leads to decrease in short chain fatty acids and
Okay.
increase atherogenic potential increasing bacteria. So TPMO is increased, methylene oxidase is increased, and that
Okay.
leads to formation of cardiovascular diseases, that a heart may plaques that get deposited and there is clogging of the arteries and heart attack. And similar is the inflammatory affecting the bowels, so they lead to formation of IBD, the inflammatory bowel diseases. So this
Okay.
is how vegetarian and non-vegetarian foods affect the gut microbiome.
So is it is it about it is in the case of non-vegetarian when it is excessive non-vegetarian food? if one is not very regular, like in a Western context, as you mentioned, even then it is a problem, or it's more about excess, or it is in generically it is going to affect.
No, it's not generic. It's again about the excess. See, there are a few kinds of diet: the Indian diet, there's a Western diet, and there's a Mediterranean diet. So if you
Okay,
see into the Western diet, they have a lot of proteins in form of animal proteins. Indians consume
right,
a lot of vegetarian, animal proteins are very less in India. And
right,
Mediterranean food has an ample combination of all. So they have a
okay,
low dairy products, more of vegetable proteins, less of animal proteins. So if you ask me what is the best diet and what you best suggest for diseases or maybe nutrition point of view, because some of the vitamins are present in non-vegetarian foods only, B12, vitamin D, and these things are a lot of present in animal protein, plus the protein intake which is requirement, recommended daily allowance of the protein. So, and the quality of protein compared to the
right,
cost what you are taking, amount what you are taking. So in this
right,
way, when Mediterranean diet is the best. So if you go for
okay.
Mediterranean, you will have ample amount of both, neither the Indian diet nor the Western diet. So less dairy product, less of animal protein, more of vegetable protein. But this combination is what is the Mediterranean diet. So I think Mediterranean diet is.
All right. Now, this while you were explaining, you referred to a word, fatty acid, fatty liver. If we look at the kind of lifestyle which is there, the weight is one of the major issues that people are facing commonly. Excess, body mass index is getting imbalanced. And the whole generation is becoming a more, having a fatty liver generation, you can call it the way it is happening at the moment. So clearly, it is caused by the lifestyle factor. So, what is your suggestion to maintain a healthy liver, or ensuring that we do not get a fatty liver, because prevention can be better than the cure?
Anytime. Prevention is better than cure. See, prevention is better than cure, and once you have a problem, then assessment is also very important. Most
Right,
of us, you see in an ultrasound, you see a fatty liver, and you ask them, what else did you have in ultrasound? Oh, doctor, I had many 10 years back. I had a fatty liver. So what they said, but doctor said, everything is normal. So if it's normal, then why was it written fatty liver in the ultrasound? If there is a
right,
problem, there's always an assessment is required. But weight is just one of the reasons why you'll have fatty liver. One of the
mm,
common reasons. Obesity
right,
is very prevalent in India, and Dr. Mohan, you know that diabetes is very common in India. So liver
absolutely,
has a lot of fat. So fat causes inflammation again. Wherever there is fat, there is inflammation. Similar is in the heart, similar is in the brain, similar is in the liver. So whenever
right,
there is fat inflammation, so your AST/ALT will increase. AST/ALT increase causes some liver inflammation. The liver fibrosis starts. Liver gets hardening.
right,
Once the liver
right,
is hardened, they form cirrhosis, and fatty liver has outnumbered now alcohol as the leading cause of cirrhosis in India. So even it has
okay,
outnumbered alcohol. So if some of the patients who come to our clinic, they say, "I've never taken alcohol, sir. How do I have cirrhosis?" So there are many reasons.
right,
Obesity. If somebody has diabetes, the fibrosis stage increases. If the patient is smoking, then again it will lead to increased hardening of your liver. But fatty liver can also be present in a lean person. It's the common misconception that you have to have 100 kgs weight to have a fatty liver. Sometimes it is present
right,
in a normal person, normal weight, height 160, weight 57 kgs, still you have fatty liver. That's called lean NASH. So,
okay,
lean person having fatty liver. That is why the concept of body BMI is now phasing out. Like your
okay,
ideal weight not important, but your body composition is important. So you may have a normal weight of 60 kgs or 70 kgs, but the composition of your body, that is the fat, protein, and bones. So you may have a lot of fat in your body. Your weight is normal. So now the body composition analysis is taking over gradually the amount of weight. So if your body has a lot of fat, it says you have fatty pancreas, fatty liver, central obesity, weight is normal. It portends you will have
right,
cardiovascular disease later on. It portends you will have diabetes later on. So body composition is more important now than that. Also, if patient is taking alcohol, so alcohol
right,
is not alcoholic fatty liver. It has nothing got to do with weight. So even
okay,
non taking fat will have alcoholic fatty liver. There are some other diseases, hepatitis C, Wilson's
right,
disease. These are liver diseases which can cause fatty liver in a normal person. So if your child have fatty liver, please get them evaluated. Are they suffering from Wilson's disease? Are they having hepatitis C? Are they obese? Or are they misusing some drugs? Are they more in triglycerides? Lipids. If you do a lipid profile, it's
Right.
some people have a genetic problem with lipids. They are
Right.
very thin thing, but triglycerides have shot up. So everything should be evaluated. If your report says something, please get it evaluated so that everything is okay. Because if it would have been okay, the report would have been a normal study. They would not have
Okay.
reported anything else. So fatty liver should be evaluated. So to prevent a disease, it's not a rapid onset disease. It's not a stomach ache. It's not a
Right.
earache that will trouble you immediately, but it will give you trouble in the long run. So in the long run, when it starts giving trouble, there is no reversal because cirrhosis cannot be reversed.
Okay. This brings me to a question, a curiosity that how can somebody, as a lay person who has no background of medicine, or can understand, that what are the early signs of liver damage?
So Dr. Mohan, just you see, the liver has a lot of resilient capacity. Resilient
Okay.
means you put in a lot of damage to the liver and nothing happens physically. So
Right.
if what you can have in the initial stages, if you have just fatty liver and enlarged liver, so 50% of these patients will have pain, 50% will have fatigue. So you have just a sense of weakness that you don't feel like doing work, you get tired very easily, and you have some discomfort on the right side of the chest or maybe upper abdomen. So these are the symptoms of just fatty liver. Once the liver gets damaged, around 70 to 80% or 60 to 70% of your liver gets damaged, that will be reflected in your liver function test. So the liver
Okay.
test, AST, ALT will increase, your albumin will decrease, you may have jaundice, you may have abdominal distension, slight confusion, and once the disease progresses, more serious complications can happen. And it's not confined just to adults, it all depends on the etiology. And there comes
Right.
the role of annual health checkup. Even a child of 10 years can have cirrhosis. It all depends on
Okay.
the disease what the patient has. So if you don't do annual checkup, it's just like your the motorbike or your car which goes for servicing. So we take our car for servicing once, before it is out of order, so that everything
Okay.
in function. You check, everything is okay, then you start driving, because once it gives you trouble on the road, you are in a fix. So,
Right.
what the health checkup, what means, and you should get evaluated whether child or your adult or your parents are healthy or not. So, who is going to tell this? The reports are going to tell this to you. And reports, who is going to
Right.
interpret? You yourself with some inputs from a talk which you have, organized this talk for the general public awareness, or you go visit a doctor if you understand, or you think reports are too much awkward.
Okay. Okay. Because we all, I mean, may God bless everyone with good health, but then we all have gone to hospitals sometime or the other. And, I remember my son being hospitalized at some point of time, and where every second day there was some test or the other, even with the liver contact, the P time, and so many things. And I left it more to the doctor's discretion than to try and understand it, because I felt that the half knowledge will be more detrimental. But then you're giving away good and very simple insight to people to understand and differentiate. Now, when we're talking about this liver, one of the very common things that we all experience. I remember during my early days, uh, when I must have been 21, 22 years of age. One fine day, I had this symptom of, I had a cold sweat. I was sweating profusely. Then I was having a little pain on a shoulder, and then it was a shifting pain in my arm. And when I went to some physician, I was given sorbitrate because all the symptoms were cardiac prima facie. And I responded to that as well to some extent. And I was immediately referred to a cardiologist. And of course, when I went to the specialist, at the face of it itself, they said they did their protocol, of course, said that it is more of a enlarged liver, or it is more gastric symptoms and all, which has induced a similar kind of symptoms. So while listening to you, I thought it will be there may be many people like me who face this difficulty, and often the gastric symptoms get confused with the cardiac symptoms, or some people ignore cardiac symptom because of they say no, it is all gas. So can you just throw a little light on that aspect?
Yeah, Dr. Mani, I think that's very worthwhile to discuss it here. Gastritis, what does your chest have? Chest has three things. You are on
Right.
the left is your heart, more of a center heart, but larger part of heart is on left. So we call it that the heart is on left. Otherwise, it's in the center of your chest.
Right.
Just in front of it, there's food pipe.
Okay.
So on by either side of it is there is the lungs. So
Okay.
any problem in the lungs, if you have pneumonia, you'll have chest pain. If you have a heart attack, you'll have chest pain. If you have a gastritis symptoms, reflux of acid in your food pipe, then also you'll have chest pain, because chest pain is what anything going inside, it's a reflection on the outside. So you have
Okay.
chest pain. But if you have diabetes, if you have hypertension, and if no acidity has happened to you before, and this is the first time you're having a chest pain with all these comorbidities, and maybe age 40 to 50, you should always look for an ECG should at least be done to rule out a cardiac disease or maybe a trop I and these things. It should always be given benefit of doubt. The doctor gave you sorbitrate because that was the prima facie first treatment before any investigations. That didn't then,
Right.
and that cause you any harm. So that could
Right.
not cause, it would have been life saving for you. So that is why your
Right.
doctor arbitrate. Then once you went to the specialist, they did some test for MI, maybe an echo, an ECG, and a drop eye, which were negative. Though that's why they said it is gastritis related. And gastritis, of course, many people have gastritis due to food, maybe some change in food, spicy food and some things. So off and on, if it is occurring, the symptoms are occurring, and you require PPIs off and on. So there are some
Okay.
alarm symptoms which should be picked up, because not
Okay.
stomach doesn't have eyes, it cannot go blind, it doesn't have ears, it cannot go deaf. The only
Right.
symptom your stomach has is gastritis, bloating, maybe burping,
Right.
vomiting
Right.
sensation. This is the only way stomach is going to tell you that I am in trouble. So it can
Okay.
be a gastritis if a person is taking alcohol, alcoholic gastritis, cigarette related gastritis, food related gastritis. But there are some other things, something bad in the liver, maybe an ulcer. So it
Right.
will also cause gastritis only. So if your symptoms are persisting, and if your age is maybe after 45, 50 years of age, if you are having a new onset gastritis, you do a hemoglobin. If the hemoglobin is low, if your stools are black, if you're losing weight gradually, relentless symptoms which are affecting your daily living, if you have a decrease in appetite. So these are the symptoms when you should get evaluated, maybe by an endoscopy and also an ultrasound. Sometimes the gastritis is caused not by the food pipe, but there are multiple organs outside your stomach, the
Okay.
liver, the bladder, the pancreas, or there may be abscess inside, there is a diaphragm. So anything irritating your stomach or food pipe will cause gastritis sensation. Anything inside your stomach will also cause gastritis. So you take one or two pills. If your symptoms keep recurring or it doesn't get solved, do visit your gastro person, get an endoscopy done, and let's see whether you're missing anything or not inside. So
All right.
gastritis is very important.
Uh, there are few terms I would like to throw upon for clarity of people, our audience, in the context of gas. One is general gas and acidity that we commonly use as a word. Other is gastritis. Other is gastroenteritis.
Hmm.
The other is people say that you've got ulcers in your intestine. So I mean, how does a common person should look at it, all these terminologies?
See, it starts, GI tract starts from mouth. So from
G.
onward, it starts. The food pipe connects to the stomach, where all your food goes and gets stored for some time before digestion starts.
Okay.
So once it is in the stomach, that is called stomach. If it is inflamed, there is problem. It is called gastritis. That
Okay.
goes to form intestines, small intestine and large intestine. Any
Okay.
problem there is called enteritis. So it's very
Okay.
simple. Gastro means stomach, enteritis
Okay.
means and intestines. So
Okay.
gastritis means inflammation of stomach, gastroenteritis means stomach and small intestine also. Normally, what is misused is you may have an ulcer. You have gastritis, and somebody tells you have ulcer. Ulcer diagnosis cannot be made from above stomach. You may have symptoms of ulcer, but unless until you do an endoscopy and visibly directly observe an ulcer, you cannot comment an ulcer. And ulcer
Okay.
treatment is different from gastritis treatment. It is nowhere related. You have to eliminate some bacteria. And ulcer, you have to see whether the ulcer is healed or not. If it's not healing, you have to take biopsies to see why is it not healing. Is it a bad ulcer, or is it just a H. pylori related ulcer? So that's important. Gastroenteritis is what some people have diarrhea, then they say that I have gastroenteritis. A doctor is told, so that's called acute gastroenteritis. That means a short term patient will develop loose stools, and the doctor says you have inflammation in one of the bowel due to some infection, some food taken outside, and they give you some antibiotics, you get okay. So gastritis is stomach, enteritis, and small intestine, large intestine, both of them together get gastroenteritis. So this is
Okay.
how they.
All right. So that, thank you so much for giving that clarity, because you know, it is you know, the moment we hear a term and which is a big sounding word, we think the problem is as big as the word is. So sometimes it's so very important to develop that clarity. This again, Raksa, brings me while you were talking a little while earlier, you talked about good bacteria and bad bacteria. And another term that I would like to use the opportunity to give clarity to our audience and who are listening to us right now is, when we talk about in the same context, antibiotic, and we talk about probiotic. So, and so in what context, and at times we are confused because as a commoners, when are we using or when is needed to use the antibiotic and when is it we need to use probiotic? And can probiotic be taken on our own call, or does it also need to be referred by a doctor?
So see, we all the person who's taking a normal food, we don't need to take any supplements. That's what I believe.
Okay,
Once you have taken an antibiotics for a prolonged period of time, we have some natural, antibiotics you take for what reason? You have infection anywhere in the body, so you take oral
right.
antibiotics. So oral antibiotics do alter your gut bacteria. So gut has good bacteria, bad bacteria. They are in balance, living in a symbiotic relationship. So involving the gut, your food, and the barrier. So once you have taken antibiotics, all of them get altered. So they kill the
Okay,
good bacteria. Sometimes the bad bacteria becomes so much so that you have an antibiotic associated diarrhea. So you took an antibiotic for diarrhea, and the antibiotic is causing antibiotic associated diarrhea. So you
right.
have to but if it is altered, if the gut microbiome is altered, you will have constantly some problems. So in these cases, once you stop the antibiotics, you give them probiotics to increase the proliferation, to increase the percentage of good bacteria. So probiotics, but that's again a defined period. You cannot take probiotics for endless period of time. Yogurt and cheese and some milk dairy products, they foster, promote growth of good bacteria. They are probiotics. So some people take it, but once if for a particular diet, the intestinal bacteria remains same unless until you change the
Okay,
diet. So
okay,
you can take probiotics, they are harmless. Like if you take yogurt, it's harmless, but there's no need to buy a probiotic and take it continuously. You have to see why are you taking. So if
okay,
you are taking for a particular reason, visit a doctor. Nobody needs to take probiotic all their life. Everything is costly, medicines more, so you don't need to take it. You
all right,
can take it. So there is difference between can and need. You
okay,
can take it, it's not going to harm you, but no benefit of taking if you have a normal bacteria in your tummy, and if all are living in harmony, you are having no gastro problems. If you have gastro problems, don't think that probiotic is a magical drug which is a solution to all your problems. Get yourself
okay,
evaluated, see what is the problem actually which is causing problem. Is it the bacterial alteration? Then why did the bacteria get altered? So are you taking enough of, there is something called prebiotics. So
okay,
prebiotics are compounds due to which the bacteria get formed. Probiotics are already formed bacteria. So are you
okay.
taking enough probiotics which will lead to formation of adequate bacteria? So these are the things that we have to modify.
Just prebiotic is something new for me also. So, like when we know that sources for probiotic is like yogurt and other things also in our. So in prebiotic sources would be what?
Complex carbohydrates which I said, on which the bacteria feeds. So these are the prebiotics. So on which you have to give food for the bacteria. The bacteria will not survive on your animal protein. That cannot eat your fats. So they need
Okay.
complex carbohydrates. So these are the roughage and fibers and these kind of compounds which will lead to formation of and lead to growth of the natural bacteria. That is why you need prebiotics also. But there's nothing definite that you need to take. You need to buy anything. Everything is there in your food. If there is a problem, visit your doctor, solve the problem rather than continuously taking by yourself
Okay.
probiotics or prebiotics. Don't buy anything. You don't buy a supplement, protein powder, whey proteins. You don't need to buy anything.
If one has a balanced diet and then the natural course itself it is taken, and I think that's why when we visit to people like you, everyone recommends ki bhai, you eat more fibrous food. I think that is where the reason and the logic behind it is there.
Yeah, definitely, definitely. You often I'll see patients taking protein powders and some whey protein. See, whey protein has a role. If there's a whey protein, there's a role. If somebody is an athlete, he needs
Right.
special protein requirements. After strenuous exercise, he needs to rejuvenate his muscles and muscle formation. So those kind of patients will require. But there is no regulation on the protein powders. If the
Okay.
manufacturer they putting in the protein powder, there's no regulation. There's no FDA regulation for that. And if the amount, sometimes the calories amount is 4 teaspoons as maybe 1200 or 1400 calories. So there is sudden
Right.
jump in calories. Sometimes there is
Okay.
sudden increase in sugar levels which cause a problem.
Okay. Now, listening to you, one thing is becoming very, very clear to me, and I'm, summarizing for emphasis for our viewers and audience that as long as you are maintaining a good, healthy, balanced food, you generally don't have to worry. And the moment it comes to a point where you think you need to buy a supplement from the market, it's better to consult a doctor and identify what your body needs and then go for the supplements, not just generically taking it, because that may not really help your cause. Because if it is a supplement, it should be given only when the need is diagnosed, not just like that. And any supplement as a natural dietary supplement, आप खाने के साथ चीजों में जो भी changes लाना चाहते हैं, which is welcome. But if it is to be purchased from the market, better consult a professional and identify the need, and only then go for buying it from the market for the supplement that is needed.
And that also at the
Uh,
right dose.
yeah. Sorry, can you repeat what you said, Doctor?
It also has to be taken at the right dose.
At the right dose. Yeah.
There's always a dose for something. If I'm giving you a supplement to replenish something, you can't replenish. Like if you have vitamin D deficiency, you cannot recover it by daily dose or something, you kind of things. Yeah.
Right.
So you have to
The-
take at a particular dose which to for a satellite to go into space, you need to have escape velocity. So you
Absolutely.
can't take small jumps and you can cross the escape velocity. It's not that way. So there's a particular amount which you have to take.
Absolutely. And before I ask my next question, let me have a natural supplement that is charged for some probiotic going in my body.
Yeah.
That is just on a lighter vein. Coincidentally, that's what I'm sipping on right now while talking to you. But Doctor, this brings me to another very commonly talked about thing in today's time, and that is vitamin D deficiency. Almost
Hmm.
every person who goes to a pathologist these days, uh, if the report is done that there's quite likely possibility that the person is vitamin D deficient. Maybe because of our lifestyle, we are more confined into closed doors, air conditioners have made us not be exposed to the sunlight all that much as well. So that is where, which is becoming one of the major concerns. So, a few things related to that vitamin D aspect of it. One question which is coming to my mind, because somewhere somebody has said to me and shared, I want to validate it from you, that if there is a vitamin D deficiency, it will be difficult to absorb vitamin C as well. There's some correlation between vitamin C absorption and the vitamin D deficiency. And the other is that if we keep on taking the prescribed dose of vitamin D daily 4 times or whatever be the recommendations by the practitioner, will that really help vitamin D deficiency?
See, as for we discussed, for everything which I prescribe, there is an evidence-based medicine which we are practicing now. So
Right,
take vitamin D only you have a deficiency. So normal recommendation by the European Society, Geriatric Society is around 30 is the normal limit. 20 to 30 maybe you can call it an insufficiency, and then a
right,
deficiency, and then around 40 to 60 you have to maintain around. So the
right,
recommendation for that is around in adults, if you are 18 years of age, adolescents and adults, is around 1500 to 2000 international units. So it all depends what food you are taking. If you are taking a food which has 2000 international units or maybe 1500, you will not be deficient. If you are not taking 1500 international units, you will be deficient. Then you go for replenishment. So once you are replenished, then again you stop taking vitamin D, and then you will
right,
have a deficiency. So are you taking adequate? Most of the time, even people who are sun exposed have deficiency of vitamin D. Why? Because
okay,
it's called a sunshine vitamin, but generally the amount, because we are covered. There is a
right,
cloth, everything is covered. So even in sun, it is very difficult to form vitamin D by itself in our body. So
okay,
even a Western, especially whatever milk you get, young people, even the orange juice, the milk
right,
which they get, the cheese with that which they get, all are fortified with vitamin B and vitamin D. So this is
right,
how they're replenishing. If we see that the vitamin D is perpetually low, then we have to go for vitamin D supplements, maybe at 1500, 2000 international units per day. That's the recommendation for
right,
maintenance. So if you have deficiency, the requirement is more. And if you're taking for immunity, then the recommendation is still more. So you have to take, but don't just start taking and then never check your vitamin D, because vitamin D helps in vitamin calcium absorption. So if the
okay,
vitamin D excess happens in your body, you will have a high calcium, because of which you will become drowsy, and you can have increase in polydipsia, you can have increase in thirst, you can have
okay,
increase in urination, you can have a disorientation. So we have patients landing in ICU with very high calcium levels because they haven't taken vitamin C and vitamin D. So sometimes
okay,
doctor gives you a vitamin D injection, 6 lakh units. So
right,
they maybe without deficiency, and then lands them in with hypercalcemia, and that is
okay,
a big problem, because decreasing calcium, sometimes you have to go on to have a dialysis to decrease the calcium, and
right,
that is increasing calcium is very slow. So the patient needs to get admitted for a week or 10 days. So that's very problematic. So once you are on supplements, do check you have hypervitaminosis of D. That's the same for anything. Vitamin B12 also. Some people
okay,
have B12 deficiency, they start injections, then they forget. So they don't
right,
know what is being tested. So always it has to be tested whether you have completed your course. Do you need to have a maintenance, or are you still on the replenishment course? Are you crossing the limit? And why not include that in the food, in the diet, which is rich in vitamin D, rather than going for supplements?
okay. Thank you so much for this insight, Dr. Sab. And we have few questions by our viewers as well. And one of the question, I think it has already been answered, but then if there is anything to be added by Neha Upadhyay Bagri, that Dr. Vikas, can you please help us understand the difference between acidity and gastritis?
See, acidity. So one is the layman term, one is the medical term. So normally, what patient uses the word gastritis, they mean acidity. So if you have
Okay,
sense reflux in your mouth, if you have irritations, burping, and you have abdominal discomfort, you take a acidity pill and it relieves. So you say that I had acidity, somebody will tell I have gastritis, but gastritis is a medical term. That what the doctor uses. And how do we use it? We do an endoscopy, we see the stomach area is red, we take a biopsy. If the pathologist says that there is inflammation, then I will call it gastritis. Otherwise, I will just call it an acidity or acid reflux.
all right. So if one sentence answer, one is a medical term, and other is a layman's term, and we need to look at it from that perspective. The other question is from Parag Gupta. Parag Gupta says that excellent session, doctor. I recently did my blood test and found SGPT, SGOT to be high around 75. What all precautions I should take and medicines or diet you recommend?
See, SGOT and PT, is found in the liver. So if the liver is at fault, if there is some damage in the liver, then your SGOT, PT, AST, ALT will increase. So if the AST and ALT increases, that means some problem is in your liver. So what can be the problem? It can be a fatty liver, a large liver, fatty liver. Hepatitis B and C is very common in India. 2 to 4% of people, with 140 crore people, 2 to 4% people, around 4 to 6 crore people are infected with hepatitis B and C. So you need to get tested for hepatitis B and C. If both are not forthcoming, then you have to get tested for some other rare diseases, autoimmune hepatitis, primary biliary cholangitis, and ceruloplasmin related Wilson's disease. So these are the tests which should be done. We should also see whether there is another systematic disease, other disease other than liver, some other organ is at fault which is causing a rise in your AST and ALT. So this is how you should get evaluated, but never ignore your rise in AST and ALT. Please get yourself evaluated.
Right. So, Mr. Parag Gupta, as you've already heard Dr. Vikash Prakash, it will also be advisable to consult a professional so that other factors, correlated factors, can be looked into and you can get adequate help if it is on the higher side. In fact, Dr. Prakash, this brings me to a point that, say, in children, if this SGPT and SGOT goes as high as 2,600 or something like that, what would that imply?
See, Dr. Mohan, see, any rise in AST and ALT, SGOT,
Right,
PT was previous term, so present new nomenclature says AST and ALT for the same. So if there is a
right.
rise in AST and ALT, it denotes liver inflammation. So within
Okay,
300, if it's less than 300, so
right,
something chronic is going on, maybe an autoimmune. In children, there is Wilson disease is common. So autoimmune hepatitis with, if your child is obese, so fatty liver related, hepatitis B and C, all five things should be tested. So if
okay,
we see that all five of them are negative, sometimes we go on to do some other more invasive test to see where is the liver inflammation going. So if your
right,
SGOT crosses the 1000 mark, so in
right.
SGOT, the most common which in India you will see is a viral hepatitis. So where
Okay,
your child has taken a fuchka from a roadside vendor, is eaten outside snacks. So hepatitis A and E. So
okay,
hepatitis is the most common cause of viral hepatitis in India and among children. So you watch where your child has taken food. The only problem with this is 99% of them resolve.
okay.
1% of these patients, child or adults, have a very complicated course extending multiple times, and very few few percent of these patients go on to have a liver transplant. So the liver
Okay.
completely fails. So 90% of patients will improve, 1% patient will not improve with enzymes in 2000. Other reasons for 2000 enzymes is a drug induced, you have taken an Ayurvedic medicine for your child for any other disease. So drug induced
Right,
liver injury. You can another alternative medicine, some plant products, something herbal products. So that has called acute inflammation in your liver. So that will cause in
right,
rise. If blood pressure falls suddenly due to any reason, that also will cause a rise in thousands. So there are very
right.
few reasons enzymes will be in thousands.
Okay. Uh, so there can be so many factors to it, and it needs to be evaluated accordingly, right? And in children, generally, they have a better resistance power, so they
Yeah.
will be able to recover faster. All right.
Yes,
Now,
that's
this,
true.
that's it's, the way you are explaining things. I'm sure that a lot of people will get a lot of insight and clarity. I'm motivated and encouraged to ask so many things that would become clear to our viewers and audience. But with limitation of time, I would still ask few more areas. One of the very common things which has a manifestation which is often psychosomatic manifestation. But then when the physical factors come in, it definitely is a point of concern. And if you can explain that to our audience, is IBS, that is irritable bowel syndrome. that's one of the very common things which are being experienced by people these days. So how would you go about explaining, and what can people do about the same?
Yes, Dr. Mohan. So I think most of the patients, if somebody, somebody has a constipation, somebody has diarrhea, somebody has, gastritis symptoms, they always say that I have IBS and I have some problems with IBS. Some of these patients have just functional constipation. Some of the patients have just, diarrhea related to anxiety. Some of
Right.
these have a pathology inside. So before labeling any patient as a case of IBS, we should always rule out that these patients don't have any disease inside. So once we have
Right.
ruled out disease, we call it as IBS. That is, it's a functional problem. It's not a stomach problem. It's a
Right.
brain problem. So there's something called brain and gut axis. So brain and gut is combined, and they are very friendly, just like Dr. Mohan and me. So both of them are combined. So if brain is at fault, the gut is fault. So the contraction of gut changes. So at
Right.
this point in time, the patient will have to go to washroom again and again. After meals, they will rush to the washroom. They eat, they are full, they have to go to washroom. After exercise, they have to go to washroom. They have abdominal discomfort, some gurgling again and again. So these are the symptoms the patients will have because the bowel is inflamed, and your
Right.
brain perceives the same amount of inflammation which was normal for it maybe sometime 1 year back, and now it is feeling the same as more, and it wants it to contract. So at this point, the patient requires not just medicines, some also psychological counseling regarding that everything is okay and there's no malignant disease, no bad disease inside. So normally, adolescents, sometimes in adults also we see, sometimes we see diarrhea, post infectious. So you have diarrhea due to an infection, your child has a diarrhea, then he frequency goes to washroom. So then he
Right.
may have an IBS, because of which, not because of just a bowel pathology, but because of also some psychological issues for which some counseling may be required.
All right. And in fact, just on a lighter note, but still on a serious information to people, often in the everyday life, we at times experience that the moment we are facing a stressful situation, say for children, if they are just before the exam, they will be fine just when they are called for their viva or entering the examination hall. They will sense that pressure in their tummy, or they will feel like urinating. There is a trigger that is taking place, and they are, as Dr. Saab quite rightly said, it's more a functional problem rather than a physiological problem. It's more at a brain function level, which needs to be taken care of until unless if the serious disease is ruled out, and that's how the combination will work of a medical professional and a mental health professional working together in some cases.
Yes, that's a
Uh,
very correct example of a child going to washroom before exams and exam fear, and your child goes to washroom again and again. You feel the patient has some disease where
right.
everything is normal and the patient actually needs some counseling. So
Absolutely.
this is how you have to see. But if your child complains that in stool there is blood,
Right.
if child gets up at night for washroom after sleeping, so these are the signs he may have some disease.
Absolutely. And that's where it needs to be looked into with a different light altogether. A related question has been asked by our viewer, that how to cure chronic constipation.
See, constipation, there are multiple reasons of constipation. So it all depends on the age. So if there is a contraction problem, if your large bowel doesn't contract, you will have constipation. If you are taking less of fibers, you will have constipation. If you have a thyroid disease, you will have constipation. So if you don't exercise, there is, if the patient has a fracture of leg confined to bed, or maybe elderly patient confined to bed, you will have constipation. If you're taking some drugs, brain drugs, so sleeping pills, so the side effect is constipation. On the serious side is if there is some bowel pathology, some malignant thing, some polyp, some stricture, tuberculosis, so which causes obstruction to the outlet, then also you'll have constipation. So if you have to see, if you're losing weight, if there is blood in stool, a falling hemoglobin, decrease in appetite, always think that it is not just a functional constipation, it's a some disease related constipation. New onset constipation after the age of 45, 50 years, get evaluated by a colonoscopy, so that we are not missing any disease inside. So these are the things which we can do for the constipation.
Thank you so much for explaining that. And I listening to you, I am making up my mind. Maybe we need to have a series with the specific areas being taken up so that we can educate more people on different disease. Because in 1 hour, because I would love to talk about the stone in gallbladder. I would like to talk about sugar and diabetes, but time is limited. But still, I would uh,
One more
I
thing,
would,
Dr. Amitabh, I'll need your help, and if you permit.
yeah,
No, a lot of children are suffering from constipation. If your child goes to washroom again and again, there is some psychological component also. There is something called solitary rectal ulcer syndrome. So they apply
right,
lot of time in washroom. So it may not be a part of constipation. So they need actually a biofeedback, a psychological counseling about
right.
the stool process. So but these class of patients also, more so in children, we send patients to psychologist, for a psychological assessment. Sometimes your child is finds the only place the child finds away from some problems is that in the washroom. So if your child
Correct.
spends a lot of time, don't always tell
Can
it
be a
that
direct correlation with self-esteem of the
yes,
child also.
yes, right, correct. So it alters the coordination of the bowels. So in the intestine, the back of the intestine, when it contracts, this process ahead has to relax. So if there is discoordination due to anxiety of your child, so in this
Right.
child of needs psychological counseling to relieve his anxiety or maybe depression or a fear or some untoward experiences in his life, in his school. Or so this is important, very important role of psychological counseling in this class of children also. So very common in
Absolutely.
children.
Thank you for emphasizing that, Dr. Prakash. And I would like to further extend to our viewers and audience. Friends, mental health is not independent of physical health. The two go hand in hand. The mind is in the body and has a connection with the whole physiology. And there are so many things. If mental health is not in the right place, it can have a psychosomatic effect, as Dr. Saab has pointed out in few areas. That examples where what appears to be prima facie a physiological issue may actually be a mental health issue and not just a physiological issue. And that is where the synergy and of people specializing in different profession helps in the overall well-being of the individual. Thank you so much for emphasizing that. And but this also brings me to issue of a lot of us know about diabetes, but then what about juvenile diabetes? Diabetes in children.
See, diabetes in children, it has come to light if the child is not gaining weight. You do a routine evaluation, you do a blood sugar, you find a high sugar. So, there are types of diabetes. The type 1 diabetes is what occurs in children. So, generally, like in adults, if you are 30, 40 years of age, the diabetes or family history of diabetes, that's called type 2 diabetes. When initially you start with tablets, and then you start with gradually 2 tablets, 3 tablets. This is the type 2 diabetes. In children diabetic, generally their pancreas is being destroyed. Generally they are of the autoimmune variety in which the pancreas has been destroyed by the body. Autoimmune mechanism has destroyed their pancreas, and these patients generally don't respond to medications. They require
Okay,
insulin from the first go. So these
okay,
patients have a new onset type 1 diabetes, which is called. And the pancreas are not there virtually, and yet they have endocrine. Endocrine means insulin related dysfunction, and you have to you put them on diabetes. So again, Dr. Mohan, we need counseling for these patients also. From the the child uses insulin and their batchmates don't use insulin. So these sort of patients also go into a lot of depression, and which is obvious that the child has to use insulin. Sugar control is very important in these patients, and since they have a early onset diabetes, complications of diabetes has to be monitored because they are going to have a diabetes for a longer time. And the
right.
psychological aspects are very important. Sugar fall is more chances because child may skip meals at some time and use the insulin. So insulin monitoring and realization is also very important. Sometimes in these children, autoimmune pancreatitis or autoimmune pancreas elimination is a part of some syndrome in which there are other diseases associated with them, like thyroid, like some
Okay.
other diseases, some congenital malformations. This should also be looked into and not just cure of diabetes.
Okay, and there's a parental anxiety when a child is diagnosed with the juvenile diabetes or with the diabetes. There's a anxiety that will my child be okay? Will he get cured? Will he have to live it with it? Will he have a normal life in future? So, what is your call on that?
So to Mansi, normal, it's just like the COVID era. That's the new normal for that boy. A boy or girl. If the patient is on insulin, it's very unlikely that he will go off insulin that because the pancreas are damaged. Just like in adults, if you are obese and then you are on insulin, and if you are on drugs, you lose weight, you may stop your insulin. So it's all related
Right.
to insulin resistance rather than insulin production. So that's
Okay.
not a miracle to if you change your diet, to vegetarian diet, maybe less calorie diet, decrease your weight from 100 to 50 kgs according to your height, and then you can go off insulin and off drugs. That's not a magic. But
Okay.
because there's a problem with insulin resistance there with overweight.
Right.
Here
Okay.
the problem is insulin production. So
Okay.
very unlikely that this patient will go off medicine. But every you have to see, don't have to see the negative thing. The positive aspect is that this boy is going to live entire life just like you without any complications. Only if sugars are controlled. So if you manage adequate sugar control, the thing is going to happen. They have a normal lifespan as like a normal people, normal human beings. They don't have a shorter lifespan. No other dysfunction is generally seen unless until they have other congenital malformations.
All right. I think that's very, very important for people to know that, the only thing, if there are no other correlated comorbidities there, is going to have an as normal life as any one of us. It's just that because insulin formation is not taking place on a natural course, the external supplement may have to be taken. Rest will all be fine, like any other normal person in such child. So that's a great relief for any parent to know this. That's one last thing because I know that we have a time limitation. You also have your commitment. But then one thing which I would like to ask you and throw an insight for all of us here is, we are very we are educated illiterate when it comes to reading the reports that we get from the pathology. And lately there has been a trend we are getting in our mobile phones that XYZ pathology has a package for your tests and all. And as the health consciousness is growing, a lot of people get the periodic test done, and they do get their you know TLC, DLC, LFT, and lipid profile, and there are so many things that people get done. And when that report comes, there are some dark areas, some light areas, and we get confused what to do. And half the people keep the report with them, and they don't even consult a doctor. And and I think the lack of awareness about these terminologies. So, what are some of the key aspects which you think is important for people to know when we get these general health checkups and get these tests? What are the things we should be looking at?
See, what actually because of lack of time, see, what we do normally is a hemoglobin, CBC, LFT, liver function test, a kidney test, and an ultrasound. This is the routine what everybody does. So CBC tells you the hemoglobin levels. So the hemoglobin levels are low, maybe may less than 13, 14. So that will tell you the hemoglobin is low. So not all hemoglobin is due to low iron. So you look into the cause of
Right.
hemoglobin, whether it is iron deficiency, whether it's the B12 deficiency, whether the blood formation is correct or not, or the blood has formed correctly, it's being destroyed. So you have to classify within these four of them. Are you losing blood from somewhere? So if there is iron deficiency, is your child losing iron, or the iron is not getting inside your child due to some diseases? So that you have to classify. If it is B12 deficiency, are you non-vegetarian? Are you a vegetarian? If you are
Okay.
non-vegetarian, still B12 deficiency, you have to see why is the B12, because your diet has B12. So then why are you having a B12 deficiency? If your cells, you are breaking up and you are losing hemoglobin, then why is the cell breaking? Is it a hemolytic disorder? Is it an
Right.
autoimmune disorder? So these are the things just hemoglobin will tell you. TLC, DLC rise will tell you the inflammation or maybe an infection going on. And but also there are percentages, DLC monocyte levels, and these tells you something else is going on, where it's a bacterial infection or a viral infection. And
Right.
along with these platelets will tell you whether you are suffering from any other serious problem. You may be a liver disease, or maybe dengue, or maybe some disorders of platelet formation. An ultrasound, most of the time fatty liver we have already discussed. What else you can see? You can see a kidney stone, you can see a
Right.
gallbladder stone, but kidney and gallbladder stone are completely different. This is like in West Bengal, we have a lot of sweating, and if you
Right.
don't take adequate water, you can have kidney stones. So some
Okay.
people, kidney stones, unlike gallbladder stones, never lead to kidney cancer, but
Okay.
these cause chronic kidney disease. If you have stones in both the kidneys and look unlooked for, you had a pain at some point of time, then you overlooked it, you took some painkillers, and the
Right.
stone has been growing. So if it has been
Okay.
growing, it can cause permanent kidney damage to your uh, kidneys. So you have to evaluate whether if it is a small stone, somewhere in the corner of the kidney, it is sitting quietly. Please observe. If it is causing some obstruction, it is causing hydronephrosis, kidney obstruction is there, then it is causing injury. If
Okay.
it's a small stone at the lower end, near the urine area, then it's 6 millimeter, 5 millimeter. High chances it will pass off. We have drugs we can give for some relaxation, and then the stone passes. Higher than 6 millimeter, maybe 1 centimeter in the kidneys needs to be removed. Gallstones are similar. One gallstones means it can form again and again. So for small stones less than 1 meter, there are drugs to dissolve the stone, but the stones
Right.
can some infection in the gallbladder, which is called cholecystitis. You need to get
Right.
operated. If it goes in the bile ducts, you will have, jaundice and other things. So stones, just look with your urologist or your gastroenterologist. What's to be done for the stone, whether any immediate treatment is required, whether you need to go for surgery, whether you need to a cystoscopic removal. About liver, we have already. Sometimes you get a role, or an impression of cystitis because ultrasound you did for pain. There is some cystitis, so some urine infection going on. Do for urine and culture of the urine. Bowel
Right.
pathology, what will also it will pick up. Pancreas, fatty pancreas means you may develop later on diabetes because the pancreas getting fatty. So please change your diet, change sugars, avoid sugars, decrease carbohydrate, decrease weight. So this is how we evaluate these functions. Kidney functions similarly, we
Right.
evaluate it. Creatinine is more than, don't wait for the creatinine for assessment of kidney damage, because unless until your 70% of kidneys is damaged, creatinine will not rise. So
Okay.
you have to see urine proteins and these things whether kidney damage has already started. Then you can start kidney protective medications. So this is
Okay.
how we evaluate the blood reports. So I know
Right.
I'm not done this because of lack of time, and
I know we will invite you one more time to for more details about certain aspect. There's one inquisitiveness I have in the context of two things which I want our audience to understand. One is every time we go with a fever complaint to a doctor, a physician, test recommended is TLC, DLC. So what does that really mean, and how does it help?
see, TLC, if it is risen, it
Yeah.
definitely means some infection is going on. In
Okay.
viral infections, what you can have some rise in TLC, but the monocyte counts will increase. Again,
Right.
a viral infection may not have at all rise in TLC and DLC. So if it's dengue, the TLC may actually fall. In severe
Okay.
typhoid, the TLC may actually fall. So
Okay.
TLC fall is also dangerous. Rise is also dangerous. If it is less than
Okay.
4,000, it also denotes a very severe infection, or
Okay.
maybe suppression. A high means again an infection. So TLC is given whether you can have a cough and cold. If you have exercised a lot, if there is some
Right.
injury in the body, in all these
Right.
cases you will have fever. So TLC basically distinguishes whether you have an infective fever or you have just an inflammatory fever. Although some
Okay.
inflammation can also increase TLC. So doctor is, and also how much is the TLC reason, whether it is just 12, 14,000 or it is 25 and 30,000. If it's 25,
Right.
30, the infection is very severe, you need to get admitted. So that is why
Right.
basic test which is done to identify the seriousness of the patient and
All
also
right.
point out about which direction to go ahead.
All right. So for our viewers, they need to understand when they get the reports, the range is important. If it is above that, then also it may be a indicative of an issue. And if it is below the normal range, even then it may be a cause of concern. your low score in medical report may not always be a good idea. Also, it is about being in the normal range, as Dr. Prakash just now mentioned. But the one last question is in the context of sugar. There's a terminology which is used is, if I may be getting it wrong, you can correct me. HB1C or something like that score is there. What is that all about?
See, like, it's not routine for all patients, but those who are diabetic, they need to do an HbA1c. Like we earlier, we used to do a morning and post breakfast sugars, then in the morning sugars. But how do we see what happened at the night? At the dead of the night, we didn't do any sugar. So
Right.
HbA1c basically tells you the average sugar you have been having over the last 3 months. So
Okay.
HbA1c, a diabetic has to get done every maybe 3 months, 2 to 3 months. They get HbA1c. The target is around, initially it was 6, so 6 to 6.5 is okay. If your target is at 6 to 6.5, we have achieved a good control of diabetes.
All
So
right. So
that
it is,
yeah.
some people say that the moment your HB1C is higher than 6 or 7, that means you become a chronic diabetic, and now you have to. Or is it just about the range of 3 months of the sugar status or diabetes status?
No, see, if you are doing for identification of diabetes, if it's more than, we can also identify whether you're pre-diabetic or you're diabetic. So if it's more, definitely it tells that it is diabetic. For diabetes diagnosis also you can use, but also for control also you can see whether you're having an adequate control in diabetes or not. So around 6 to 6.5, if you are having your an adequate control of diabetes. See, because if somebody has a HbA1c of 7, 7.5, they can go for a diet modification, they can go for an exercise, your HbA1c will come down. That doesn't mean that you don't have diabetes now. It was
Okay.
diabetes, and now you are on diet control. So that
Okay.
is how you are controlling your diet. At some point of the time, you lose your control, then you need some drugs, but that doesn't make you non-diabetic.
Okay. All right. Thank you so much, Dr. Saab. It's really been an insight. I think that it was a crash course on the basic medical areas that I had talking to you. I'm sure my viewers and audience, those who were watching you live and those who will watch the recorded mode, will have a lot of insight into various medical areas which are lifestyle related issues or which are some of the most commonly experienced issues, medical issues, and the concern that we have. And you have beautifully explained it to us. Thank you so much for your time and insight that you have given to us.
Welcome. Thank you. Thanks for the opportunity, Dr. Amitabh.
Thank you so much. Friends, you were listening to Dr. Vikash Prakash, and I'm sure you'll agree that the simplicity with which he has explained every aspect of the medical condition that we have asked you only goes on to say that if you have a right professional help, you will always be you will have a good physical and mental health. And the, when you have a condition, you don't need to worry and get psyched. And please do not avoid it thinking कि भाई अभी तो थोड़ा ही है बाद में देखा जाएगा, because earlier the diagnosis, better in control you are. And if the situation is such where your natural normal food and the dietary provisions, you are looking at your own self, you are going to the internet trying to read and study, you're trying to talk to people who are recommending one or two good tips, and you are going for supplements on your own, it is better to reach out to a right professional so that you get a right diagnosis and the right need identification. A need identification not only means that if the need is identified, you'll always be put onto medication. While listening to Dr. Prakash, I was very, very inspired and motivated that he has been putting emphasis on the diet. And his first focus is get your basics right, get your diets right. And if you don't do that, and if it cannot be controlled with that, only then comes the time for the medication. And so when you reach out to a professional, it is not always the medicine unless it is required, is what the professionals do. We have to have the faith, friends, and these times, the Corona, COVID times, I think we have developed a belief and we have developed an insight. There are always the human factor will be there. medicine as a profession, doctors as a profession, they are amazingly good people, and it's an amazingly noble profession. It is there to help us. There can always be an individual or two where you may have your disbelief and your fear and your question marks, but then that should not be generalized, because you have people like Dr. Vikash, Prakash, who believe in a systematic intervention, who believe that the primary prevention is the first, and if it cannot be done that way, only then the help and assistance, only as much needed and only when needed. I hope you benefited from our interaction today. I gained a lot of insight, and I realized the areas of concern which I need to be cautious and be timely about seeking intervention. I hope you also understood the same. Thank you so much for being with us, always encouraging us and supporting us. We are going to bring you another social educational influencer, or someone who is going to influence your life to keep it healthy, physically or mentally. We are going to be with you every Monday, 4 p.m., only on Ed Talks with Amitabh at the School Times web channel. Till then, till we meet next, take care, stay safe. God bless.